In President Biden's first statement since announcing his prostate cancer, the former president said he has learned we are strongest in broken places and gave thanks for love and support. The president is said to be evaluating treatment options. So for tonight's interview, we are joined by Dr. Maha Hussain, Deputy Director of the Robert H. Lurie Comprehensive Cancer Center at Northwestern University. Doctor, thank you so much for being with us. What is the prognosis here? Help us understand it.
Absolutely, and thank you, and it's a pleasure to be joining you. Basically, anytime you have metastatic cancer, especially prostate cancer, it's not a cancer that can be cured. However, the good news today is the fact that we have come a long way with regard to the management of this cancer, with significant improvement in the average longevity. When I entered the field literally in 1990, if somebody developed metastatic disease, their average longevity was about 2.5 years. Right now, the average longevity for patients with metastatic disease is 70 months, almost 6 years, and it's actually improving. And a lot of the improvement is a function of significant improvement in research and new treatments available for patients.
What are the treatments possibly available to the former president?
Yes, so obviously, for metastatic disease, I'll speak in general, and certainly these are options available for all patients potentially, but taking into account different other individual factors. Technically, hormone treatment, or what I would call anti-hormone therapy, is the backbone of the treatment to shut down the testosterone production, which will then starve the cancer. This is combined with additional agents to help deprive the cancer further from any male hormone like hormones circulating in the body. And nowadays, we have also triplet therapy with the addition of chemotherapy to the hormone treatment. And again, all of these things take into consideration the patient's comorbidities, the safety of being able to do this, and of course, ultimately, it's a shared decision.
There are a lot of people who are hearing about this and wondering, should I get screened or not? Can you give us guidance on that, particularly with respect to this question of if you're a male over 70?
Yes, the answer is yes. And this is something that discussion happens with the primary care physician. I would say anybody who has symptoms, they should be definitely evaluated. And this can be a combination of care with the primary care physician and referral to urologists. Anybody who doesn't have symptoms, but otherwise okay, in good health, definitely I would say PSA check is going to be important. And if it's slightly elevated, they can wait a little bit and repeat it in 2-3 months and see what the numbers look like, and then decide on the next steps.
We have just a little over 30 seconds.
It should not be ignored.
We have just about 30 seconds here. What's driving the increased incidence of prostate cancer rates?
Well, I think it's a combination of factors. Some of it may be better strategies to detect the cancer. There could be other, biological or exposure reasons that I'm not really aware of specific data. But I think a lot of it is because we're able to diagnose it much better now than we were able to do it before. And one thing I would say is this: the incidence of patients with spread prostate cancer, unfortunately, has gone up since the early detection with checking PSA was removed from the guidelines and things.